yeah, first I just kind of wanted to start with where we currently at in society and the traditional medical model and what it's good for, what it isn't, and then what's functional medicine. So when we think about traditional medicine, so I'm trained in that, as a nurse practitioner, 15 years starting as a nurse, and then about 11 years ago as an NP. So I do not discredit what they do at all. It's just not for everybody, and it's not the strongest suit to help with nagging symptoms or chronic illnesses. So it is amazing for surgery and trauma. My father's an orthopedic surgeon. I mean, when you need surgery, that's where you go. And when you have an acute problem, you're going to the ER. But sometimes it really isn't meeting the needs for these chronic conditions that really don't need to be chronic. So, we're often at this life stage that, okay, you have disease is really a spectrum. So the traditional model sees it very black and white, like, okay, you have diabetes. Well, it actually took 10 years for you to get there. Okay, now you have a diagnosis of Hashimoto's thyroiditis. Well, actually it took about 5 years of this continuum of symptoms that then now you have this diagnosis. Okay, you have anxiety. That's really a symptom. What's the underlying cause of anxiety? So it's just kind of taking a step back and taking off the lens of just labeling. So it's more about the function. Like, say if you have anxiety, okay, what's your function like? That presents in very different ways. So it's a functional model. And then it's also a root cause model. So as you just kind of define functional medicine, you can just think of it as root cause medicine, and really getting to know those underlying causes, which are multiple and literally vary depending on the person. So, say one patient has depression, the current model will do the pill for the ill. Okay, here's your diagnosis, here's the pill. But for people who don't want to be on a pill the rest of their lives, and they want to actually understand, why am I suddenly, after I'm 30 some years old, I'm 40 years old, why am I feeling this way? Like, there's something underlying going on, but all your labs from traditional seem normal and you're just given one solution. But here's just to kind of break the paradigm that there's many different solutions. So it's not to say like the pill is a bad solution. It's just not a solution for everybody. And that's more where I lie. Personally, I'm just always been gravitated, like since the beginning of my career, like if I can do minimally invasive, if I can do a preventive approach, if I can do a natural approach, then I'm going to do that. And when I had my own children and was starting to feel like fatigued and anxious and having like sleep issues, and really the solutions a traditional model gave me was, okay, here's counseling and here's some pills. So that can be fine, like short term, but nobody was giving me or my patients that I was going through NP school and I'm like, this is not an effective solution. A 5-minute visit does not equal health. So I experienced that on my own end too, which gives me a lot more compassion, for people. But basically, if somebody has the symptoms of depression, that 2 different patients can have very different causes for depression. So that's where functional medicine shines, and looking at those deeper imbalances. So, okay, this one has depression. Let's look at the causes, which could be vitamin deficiencies and imbalances, could be a low thyroid function, could be they have some gut health disturbances that we don't know. And once we repair those things, then the symptoms then resolve. Whereas other patient could have depression and have a totally different host. Maybe they have low antioxidants in their body and their adrenals are super fatigued and their hormones are out of balance and they have more metabolic blood sugar problems. So it's not a one size fits all approach. And I really appreciate that because it's more customized, detailed care than just, hey, I got a couple minutes to see you and I'm going to give you the same solution no matter what. because we're so dynamic, we're so individualized, and the same solution now for you isn't the same one for a couple years from now. You know, we just evolve. And so I love the personalized approach of it. And for me personally and my clients, just seeing the improvements, it's the most gratifying work. So yeah, it's basically been a dream of mine to do this, but it's just been 15 years in the making.
I love this, Jackie, and if it's okay for me to interject
Of course,
here, it's
yeah.
sort of like I'm a very visual person, so it's
Right.
almost like thinking of an iceberg. So you really just see that little tip, and that's what, you know, traditional doctors are looking at symptom wise, like that's what they're going to treat. But really under the water, there could be a host of other reasons causing this little, you know, piece to stick out, and
Yeah.
that's what's, you know, their main focus, but underneath,
Yeah.
underlying is so much more. So I
Right.
love
Oh,
this thought. And I also like the thought too that maybe, you know, with your first pregnancy or after you have your child, I suffered from anxiety and depression, but it looked very different in my next child. And so not having throwing the same pills and counseling, yeah, that worked the first time, but maybe it's a totally different reason the next time.
right.
And then I also like the thought of, because I've gone through it, of doctors doing labs, and because you're within this normal range, but you could be so close to being abnormal, but since you're in that normal, they're like, oh well, you're fine, so
Right. Right.
let's just move on. Whereas, you know, tweaks, which is what you do, simple tweaks and things, pill bottle, really easy natural change within our daily lives could make such big impactful changes for us.
Right. Thanks. That was really cool. I really enjoyed that visual. I think that's a great point. And it's just like, yeah, these symptoms they're not saying what the cause is. So that's really where like that deep work with me on a one-on-one basis happens.